Yes. So this is alcohol. So what is the popular saying about alcohol? What is the popular saying about alcohol? Means first man takes the drink, then drinks take the drinks, then drink takes alcohol. Okay, remember, first man takes drink, that means to taste how it is, stimulation by friends, by peers, something like that. Then drink takes drink, that is the stage of physical dependence and psychological dependence. Then drink takes man, that means he will be rude about family, the wife will leave and go with someone else. Okay, that will happen. You know, modern girls are not older girls. Okay, now they are very active and very, what to say. Okay, so then when drink takes man, he is unable to control himself. He needs morning drink, afternoon drink, everything like that. Okay, he is totally out of control. All the systems are failed. Okay, cerebellum function which regulates the body, everything is failed, and totally the person will die within few days. So what is this alcohol? Alcohol means ethyl alcohol. Okay, but there can also be methyl alcohol. Methyl alcohol poisoning is dangerous, or ethyl alcohol? Which is dangerous? Methyl alcohol is very dangerous because first dose the patient is out. Really, if he takes the toxic quantity, even with the first dose of this methyl alcohol, the person can die. Okay. So that's what happened with this local made arrays. Okay, they are now unable to purify this methyl alcohol and ethyl alcohol. The local made array. Okay, they use some procedures where they are not able to distill or purify this, and there the person will die. You might have seen Kalbati-Sarai, so many people will die. Why this happens? Because of methyl alcohol. They are unable to separate this ethyl and methyl alcohol. Okay, so what happens? Alcohol is a substance which mixes with blood like very close friends. Okay, they can be very close friends. Why? Because high lipid solubility. Okay, it can mix with blood very fast. So absorption in this stomach is about 20%, then the small intestine is about 80%. So what are the factors which influence you? Okay, we told beer, rum, gin, like that. Okay, how it is? Based on amount of alcohol which is present. Beer it may be 10%, later 20, 30, in wine it will be 40%, like that. So that's it. As the concentration increases, that is very important. If you get high concentration, even low amount also can cause toxicity. So amount consumed, yes, initially you may consume 2 packs, later 4 packs, 8 packs, then half liter, 1 liter. So amount, food in the stomach, yes, if some amount of food in the stomach, it delays the absorption. But if it is empty, faster absorption. Mood of the patient, wife has left him. What happens? Mood is bad. If pyloric spasm is a positive, pyloric spasm is there, it will not enter the stomach, small intestine faster. Okay. So distribution, uniformly distributed, no Vedabhava, uniformly distributed throughout the body. Readily classes placenta and exposure to fetus, that is very bad. Okay, if a mother consumes, nowadays female drinkers are more. Okay, so if a mother consumes, what will happen? It will readily class placenta and cause fetal alcohol syndrome. Okay, I'll show the photograph in the last. So what is the behavioral psychological affection of this effect of this alcohol? Decision making skill is impaired. Cerebellum is the one. Okay, the cerebral cortex, it plans, but execution part is held by cerebellum, a small brain which is there. Okay, so cerebellum, that functioning execution part is inhibited here. Decision making skill is impaired. Alcohol lowers the inhibition, impairs the ability to make wise decisions. Okay, immediate effect of alcohol reduces the frequency of nerve transmission. It will cause dehydration. How? It increases the maturination reflex. That's why you can see a person who has taken alcohol till here will be maturing and water in the stomach. Okay, maturation will be increased. That's why it will cause dehydration. So loss of water from the cerebrospinal fluid that impairs the rational decision making. It irritates the GI system. Okay, already HCl is there, and one more alpha you are adding. What happens? More stimulation of this gastric acid. Okay, so this HCl will break the barriers of this GI wall and it can erode the skin and cause GI ulcers, peptic ulcers. Okay, hangovers will be there. Long-term effect is cardiovascular side effect, nervous system side effect, liver withdrawal. What happens? What happens to the hepatic enzymes? 3 times increase, 300 times increase. Okay, what happens? Liver fatty changes, later cirrhosis of liver, and once cirrhosis has occurred, portal hypotension. Okay, portal hypotension, swelling of the limbs, all these things will take place. So chronic inflammation of the pancreas. What does pancreas do? It helps in metabolism of the food we take, and also it releases insulin. Okay, exocrine function, endocrine function. Exocrine is metabolism of the food. Endocrine is the release of insulin, glucagon, all these things. Okay, insulin helps in utilization of the glucose. Okay. It can lead to cancer, GI ulcers can occur, chronic inflammation of the pancreas, pancreatic cancer can occur. Impairs the ability to recognize and fight the bacteria and the viruses. The cells will also become dry. They will not know which is bacteria, which is virus. So what are the medical complications? Fatty liver, hepatitis, cirrhosis, esophagitis, pancreatitis, polycystic. So this is one symptom you need to know. The B complex deficiency or this family deficiency can cause pernicious cause of syndrome, that is mental. You can take it as a brain impairment will be there in this pernicious cause of syndrome. Hepatic encephalopathy will be there, cerebellar degeneration, central quantum myelosis, and dementia. What is dementia? The person will not be able to recognize his own 5 children like that. He will forget. That is good or bad? So, medical complication, nutritional deficiency, folate, thiamine, carboxy, or absorption will be decreased. The basic thing is here GI mucosa is eroded and it may no longer be able to perform the normal activity of absorption. Okay, so all vitamin deficiency syndromes will be there. So metabolic electrolyte disorder, as we told, it will increase the urination, absorption is decreased, so urination is increased. Electrolyte loss will be more. So it will go for hypoglycemia. Hypoglycemia might insulin release may be more, but glucagon secretion may be appropriate. Thereby it will go for hypoglycemia. Ketoacidosis. Okay, ketoacidosis is a very high blood glucose level. So hyperlipidemia, hyperuricemia, that is more amount of uric acid accumulated, hypomagnesemia and hypophosphatemia. So finally, after few years of taking, there will be neuropathy, myopathy, cardiovascular arrhythmias, hypertension, bone marrow acrocytosis, anemia, thrombocytopenia, and leukopenia. All type of blood cell function will be decreased. Okay. Once bone marrow is affected, what does bone marrow do? It is the birthplace of blood cells. Okay, when that is not functioning, all type of cells, whether it is thrombocytes, leukocytes, neutrophils, everything will be lost. What does this neutrophils, leukocytes do? They are white blood cells. They are fighting system. They are the body defense system. Body defense system is out. So complications are testicular atrophy, amenorrhea, diabetes, osteoporosis, cancers, all these things are there. What are the fetal alcohols in this one? Okay, what are the pharmacotherapies? Okay, pharmacotherapies will need to be very important. Why? If the patient comes to you and you tell them, stop alcohol tomorrow, what will happen? He will not stop. He will not stop, that is another story. But what will happen to the doctor? He may hit him. Okay, that is one thing, worst part. Another thing is, he may change the doctor. That is a loss for the doctor. Right now, because alcoholic patients are patients forever. Right? So, patients, you should not lose the patient. That's why you should tell sweetly, you reduce the alcohol what you are consuming. Okay? That's why pharmacotherapy is one. Okay, that's why what we do, effective treatment is to push the reduction in alcohol problems. 50% reduction in consumption. That is a very great success. Even if the patient is able to reduce 50% of alcohol what is consumed, that is a great success. Okay. So, 1/3 abstinent. Okay, 1/3 of the patient, good patients who can understand you in early stage, they can stop drinking. So, we should know when to tell what to the patient. So, alcohol withdrawal symptoms. What happens? So, even if you tell the patient to stop alcohol, there is neurological disturbance which is created in the brain already. How neurological disturbance? Do you remember yesterday we showed the diagram of benzodiazepines, barbiturates, and also alcohol which is acting on this GABA receptor. Okay, so it can act on GABA, it can act on NMDA, it can act on AMPA, it can act on glutamate. It's a universal soldier. Okay, why universal soldier? Because it can disturb every known system in the brain. Okay, soldier which is not helping the patient, soldier which is helping the deterioration of the patient. Okay, that's why what can happen? So it can cause, once the alcohol is stopped, daily you was taking some alcohol, once it is stopped, what can happen? Tremors, agitation, restlessness, tachycardia, hypertension, and if you stop suddenly, there can also be seizures. That is dreaded. Okay, so that is also helpful for the patient by telling that you reduce the amount of alcohol, later you can stop. Okay, that's some of the people will take it as advantage. Okay, doctor has told me to drink. Okay, that is to save the patient from these symptoms. Okay. So general principles, you know the person is dehydrated. First start IV fluids. Okay, IV fluids plus B complex. What we need in B complex? Thiamine to prevent this psychotic symptoms, wernicke acid syndrome. Okay, you need to give B complex plus vitamins first. Okay, I started IV fluids. There can be hypoglycemia. So better is dextrose normal saline or 5% dextrose. Okay, DNS or 5% dextrose. Have you seen what are the IV fluids which is placed in the? Someone started already working in the hospitals. Okay. So this is it. Alcoholic patient, you need to start with DNS with MVI. MVI is multivitamin injection. So careful monitoring and supporting care, correct the imbalance, correct the nutritional deficiency. What else you can give? Diazepam, make the patient to sleep, muscle to relax, make him forget the things. Okay, so you can give diazepam also. Restrict the access to addicting substances. You need to tie the patient in a particular room so that he will go out and drink. No use of treating him. So the drugs which can be used are to prevent the craving. Okay, to prevent the craving or prevent the symptoms of this hypertension, tremors, and all. You can start with diazepam. Okay, diazepam you already know it is a drug of choice for seizures, and it can be helpful in this patient also. Okay, so benzodiazepines, diazepam, chlordiazepam, oxazepam, all these drugs are used, and your drug is baclofen. Baclofen is the drug we are using for smoking cessation. Okay. So what does this drug do? DISULFIRAM. Okay, lot of people use this DISULFIRAM drug to prevent this person from taking alcohol. It is a drug to prevent this alcohol addicts by giving it. What we do is, once ethyl alcohol or alcohol is there in the body, it is metabolized to acetaldehyde, then to acetate. Okay, so normally it happens. If you use this disulfiram, what happens? It cannot get converted to acetate. So this acetaldehyde accumulates in the body. You know this acetaldehyde is a toxic substance. It can cause flushing, headache, palpitation, dizziness, and nausea. So here the patient is in confusion. If you stop, there is tremors. If you use this drug, people are giving the DISULFIRAM, and this DISULFIRAM is causing all the side effects. He will be confusion for few days. But later, once the symptoms of alcohol are decreased, he will be fearing to take alcohol. Why? Because DISULFIRAM is there in the body, and if he takes alcohol, he will get the symptoms. Okay. Flushing, headache, palpitation. You know what is palpitation? Knowing one's own heartbeat. Okay. So now you are not able to sense your heartbeat, but at times of danger, once you run, you get to know your heartbeat. That is called as palpitations. So palpitation, dizziness, nausea, all these things will be there with DISULFIRAM. So it causes anti-abuse reaction. How anti-abuse reaction? You got to know it. Due to accumulation of this astrologia. So at the class for 7 to 14 days, and the other drugs which will produce this. Okay, DISULFIRAM is a primary drug, but other drugs which have this side effect are metronidazole, chlorpropamide. Metronidazole, do you know where we use it? For amoebiasis. Metronidazole can be used for amoebiasis and also for vulvovaginitis. Okay. So chlorpropamide, it was a drug which was used as an antidiabetic drug previously. Nowadays we don't use it. Topiramate, chlorpropamide, both are antidiabetic drugs. DISULFIRAM, have you heard of it? What is it, DISULFIRAM? Antifungal drug. Okay. Cephalosporins, have you heard of it? Taxine injection. Taxine injection, have you heard? Yes, it is a cephalosporin. Okay. All these drugs can have this DISULFIRAM-like reaction. Okay. So contraindication, we cannot use this DISULFIRAM in liver disease. Then the next drug is Acamprosate. Okay. Acamprosate is a calcium acetate homotolate. Okay. What does it do? It restores some of the abnormalities which are caused by this alcohol. Okay, what it does? It restores the GABA activity, reduces the glutamate surge, and inside this NMDA receptors. Okay, it tries to normalize the destabilization caused by alcohol. So acts as a neuroprotectant and protect the neurons from damage caused by alcohol withdrawal. Prevent the relapse in heavy drinking. That means it can suppress the craving symptoms also. It is neuroprotectant action means free radical scavenging action is there. So Acamprosate acts on GABA receptors, enhances it, glutamate, and also NMDA receptor action is there. Assignments. Okay. Naltrexone. Opioid blocker. Here Naltrexone. Have you heard of this Naloxone, Naltrexone? These are the drugs which antagonizes opium. Okay, opium, morphine, pethidine, all these drugs. Okay, their action is inhibited, and this can also be helpful in case of abuse of alcohol. Okay, because opium or the morphine or the cocaine, they also act by acting on this GABA receptors, NMDA receptors, and all. By using the antagonist of that opium, that is naloxone or naltrexone, here also we can reduce the craving symptoms. Okay. Evidence of reduced craving and relapse rate. So it can be helpful in this, and this they are founded by giving placebo. You know what is placebo? Have you heard of placebo? No. I will tell you later. Okay. So Ondansetron, have you heard of this? On-time injection. Okay, on-time injection also have this DISULFIRAM-like reaction and anti-abuse-like reaction. Okay. So 5-HT3 antagonists exert their anti-drinking effect through corticomesolimbic dopamine system modulation, improves the drinking outcome in patient with early onset alcoholism. Adverse events are mild, includes start because of poor metabolism complication. Ondansetron can be helpful in preventing the drinking. Okay. So Topiramate, have you heard of it? Topiramate. Yesterday we have discussed it. Where which topic? Anti-epileptic drug. Okay. So Topiramate is the drug which can be used as an anti-epileptic drug. You can act on this GABA receptors and enhance the action of GABA and increase the glutamate effect. Next. So what first line drugs: Acamprosate, Naltrexone, and DISULFIRAM. Okay, as a single agent where they can be enrolled, Acamprosate helps in complete abstinence. Complete abstinence is complete stoppage of taking this alcohol. Okay, so get started immediately during first consultation. You can start it as early as possible. So Naltrexone, they can be helpful in heavy drinking, and here before giving Naltrexone, liver test is mandatory. Okay, for Naltrexone and DISULFIRAM, you need to remember they can cause hepatic damage. If the patient is already having hepatic damage due to alcohol, we cannot use it. Then our choice will be Acamprosate. Okay. So other drugs which can be used are benzodiazepines, clonidine, and paclitaxel. Benzodiazepine, the common drug which we use is diazepam. Okay. So methyl alcohol poisoning. Okay, we told that methyl alcohol poisoning is very dangerous. How it occurs? By improper synthesis of this ethyl alcohol. Okay, local